Hello, Ruth.
Hello.
For joining me today. Can I ask you to introduce yourself first, please?
Yes, of course. I'm Dr Ruth Bushaway. I'm a GP and I'm the Medical Director of the Suffolk GP Federation.
Thank you. I've got generally four questions to ask you.
It seems like a long time since this all started, doesn't it? And I, as I was walking on my new daily walk this morning, I was thinking about how far we've come and what's different. I think I'm in the second phase of looking after myself. The first phase was much more emotionally driven and probably involved a bit too much chocolate. But now we're sort of more in the sustainable phase. So for me, it's getting a bit of exercise. It's the distraction seed planting that I did a couple of months ago, which are actually starting to show shoots, if not fruits. And really the work with my children to try and help them in what is weird times. And I think really it's about physical and mental. And I think I'm very fortunate to be surrounded by really nice people that I work with, and all of my meetings actually are in an enjoyable place to be. So I felt extremely lucky. We've been very busy. And myself and my colleagues on the board of the Federation have had to tell each other to take some time off, because it's very tempting to just keep going at it. But we've very much had a spirit of openness about that since I joined the Federation. So I think that's not a new thing for me. And I have also shared with my colleagues, leaders in the Federation, some guidance on how to lead and how to support people with well-being during difficult times such as this. In actual fact, the resources that I shared with my colleagues in the Federation was shared to me from the West Suffolk Hospital. So that's the other thing that's been really beneficial, is actually working with colleagues across the system. Has been again driven on very much a supportive foot, which I think has made everybody's life a lot easier. Thank
you. Yeah, I recognise that second phase too, and it's really important to look after each other, isn't it? And if there's help elsewhere, use it.
Yes, absolutely. And I think linking in with colleagues like yourself in Healthwatch, and some of this, obviously, that was present before COVID, all the work that we were looking at doing with the wider mental health picture, but across Suffolk, as I was finding my feet as medical director and getting in touch with your colleagues in the voluntary and statutory provider services, all of those links that you were able to then help me with. Particularly the how to use Teams and how to use Zoom. The easy read, spectacularly helpful, but obviously more seriously in a much wider context. And I think that's been really good, that sharing of resources, that sharing of opportunities for colleagues and for staff to really seek help, particularly mental health. And I really appreciate how that was anticipated and came out really, really early. Yes, I think it has changed quite a lot, hasn't it? I think most people will recognise that. I think there's various pushes for that. I think there were changes that were already happening with online and telephone consultations with GP services. And I know that has certainly sped up during COVID. And I think the drivers for that are safety of patients, safety of the clinicians, but also efficiency and trying to think of other ways that we could manage patients' concerns and things that they felt needed to be addressed with a consultation with their practice. As the Federation, we also provide the services of cardiology and ultrasound and podiatry and diabetes. And again, there were those things had to change. We, for example, carried on doing the very necessary, urgent ultrasound scans, but due to the more time taken to do the scans and to keep people safe and social distancing, we sort of cut down, shall I say, the number of non-urgent ultrasounds until the time came when we could reinstate those. So things definitely changed there. That will have affected people, but safety, I think, not only in terms of the virus itself, but actually in terms of not leaving things, was very much on people's mind. And I think safety netting, ensuring that people were really aware that they could and should be contacting their GPs and the wider health system, really, I think, came to the fore fairly early on, to be honest, when we recognised that actually there was normal things going on as well as the COVID situation. And I think going forward, the face-to-face contact in primary care, from my understanding, has been something like 5 to 10% of contacts have been face-to-face during the COVID crisis, which is considerably down, particularly in the out of hours, which the Federation run, from something like 90% down to 5% at one point. And whilst that has meant that the opportunities for remote consultations, whether that's more convenient for people, helpful for people who are housebound or in care homes and so on, there's opportunities there, but actually that probably is that. I was going to say probably, but that isn't where that's going to stay, because ongoing clinical conditions, of course, are still present. And I think there has been a bit of a tension there, difficulty there about people knowing whether they are bothering their GPs or being scared to go to either practices or the hospitals and the actual buildings themselves because of the COVID, but also workforce concerns that they're potentially causing unnecessary work. And I think that's a really difficult message to get across and to understand, and it's very nuanced. And I think what I would say is that there probably are some people who are holding on to things that perhaps it's time that they spoke to somebody about. So if that is, if that is anybody watching this, then I would encourage you to go and speak to somebody at least.
So you adapted fairly quickly, or you had to adapt fairly quickly and safely, and some of it will remain as a new way of doing things, but you want to make sure that people aren't unnecessarily trying to look after each other, after themselves.
Yeah.
Doing it.
Yes, and also recognising that those remote contacts are helpful, but not always accessible for everybody. There have been some additional benefits. I think what a few of my colleagues have said is that they've had really good three-way conversations with deaf patients that they've never been able to have remote consultations before, but actually with online usage of signing interpreters, for the first time that's been manageable. So the opportunities are there, and I think we just need to really make sure that we take them and are aware of them.
That's really good news. Thank you.
Mm-hmm. Yes, absolutely. I think like we've mentioned about people who have difficulty accessing remote consultation, and I can think of two groups particularly: those in the elderly and those shielding in care homes, who have. We've all sadly heard reports of the difficulties that they're having in care homes, and I think that balance between again making sure that they have adequate support and healthcare versus unnecessary visitors to the care homes, even if that is a doctor. I think we've really looked at that, and in terms and that's not just in care homes. Of course, there's lots of people in private homes who are also shielding. So yes, absolutely. The other area which is a real importance is safeguarding. I think there are a lot of vulnerable people who the lockdown in particular has made life very difficult for. And I know that we need to make sure that every contact counts, that we're aware and looking out for and ensuring that if somebody has one opportunity to disclose a safeguarding issue, that opportunity is allowed to be taken up. And so I've made sure we've talked on all the calls that I've been on, that when you do speak to someone or do have a contact, whether that's remote or face-to-face, but particularly when it's face-to-face, to use that opportunity to pick up what might be hidden, and particularly with vulnerable patients.
Those 3 words, every contact counts, are really, really important, aren't they?
Yeah, absolutely.
And my last question, what learning do you think will come from this outbreak?
I think there's the scientific and the epidemiological learning, and that's very it all feels like we're all back at medical school, I have to say, learning new skin conditions and so on. So there's that learning. But for me, the biggest learning is the system and organisation partnership working. I've met a lot of people in a very short space of time, and we've made a lot of changes and got things done. And the advantage with this pressure that there was to find fixes has meant that we've been forced to work together, been forced to break down barriers, and really work in a spirit of cooperation. And that to me has been a really positive silver lining to this really difficult time. And I really hope that we can carry that on for the benefit of the population, really, that actually we can make transitions from one care provider to another, whether that be from general practice to the hospital or the hospital to the hospice, or whatever that is. And with the community services in particular as well, new relationships have been formed or built upon, shall we say. And I think that's been really, really exciting. For want of a better word, and really positive, that actually we've done not just the Federation, of course, but we've done some brilliant stuff across Suffolk and North East Essex to really make the best of what has been a very difficult time.
I think what you describe is probably reflected in the community itself as well, isn't it?
Very much so. And I think there's the kindnesses that have been shown from neighbour to neighbour, from people going to get prescriptions, to doing shopping, and just general kindness has been really heartwarming, and I do hope that carries on.
Ruth, thank you very much for your time, and thank you for your thoughts.
No problem. Always nice to speak to you, Andy.